This is an announcement from the Mukumi Clinic, a specialized lymphedema treatment center located in Shinjuku, Tokyo. At our clinic, we provide international lymphedema patients with state-of-the-art treatment for lymphedema. In this video, we'll explore lymphedema in detail, covering its key aspects such as the condition itself, diagnostic methods, and treatment options. Then we'll take a closer look at lymphatic venous anastomosis, or LVA, which has attracted much attention in recent years. In our bodies, lymphatic vessels run parallel to blood vessels throughout, carrying lymph fluid. The lymphatic system helps recover excess water, proteins, and fats from tissues, and is known to play a vital role in supporting our immune system. Lymph fluid generally flows from the toes, traveling along the inner side of the leg to reach the lymph nodes in the groin. From there, lymph from both sides of the body converge at the pelvis to form the thoracic duct near the spine. Ultimately, the lymph from both the left and right arms converges before returning to the heart. Lymphedema is a prominent condition associated with the lymphatic system, a condition where the flow of lymph fluid is obstructed, leading to swelling. Lymphedema is classified into two types: primary lymphedema and secondary lymphedema. Primary lymphedema is caused by congenital abnormalities, while secondary lymphedema develops as a result of acquired factors such as cancer treatments or traumatic injuries. An example of primary lymphedema is a case where congenital factors or growth-related changes lead to obstruction or rupture of the thoracic duct. This condition can result in the development of pleural effusion or ascites and, in some cases, may cause edema throughout the body. Lymphedema may also occur in the upper or lower limbs due to lymph node atrophy. It's also possible for narrowing or dilation of the lymphatic vessels, as well as valve abnormalities to occur, contributing to the onset of edema in the upper or lower limbs. An example of secondary lymphedema is when the lymphatic flow from the legs is obstructed at the groin due to the removal of pelvic lymph nodes during gynecological surgery. This can lead to the development of lymphedema in the lower abdomen or the inner thigh. Performing lymph node dissection or radiation therapy in the pelvic region frequently results in the development of edema in areas close to the treated site, including the abdomen, groin, and inner thigh. Post-treatment swelling resolves within approximately 1 year in 80 to 90% of patients, indicating it is a temporary swelling associated with cancer treatment. On the other hand, in 10 to 20% of patients, the swelling persists and develops into lymphedema. The swelling gradually worsens, extending to the inner knee and, in more severe cases, causing hardened swelling that extends to the ankle, the top of the foot, or even the toes. Occasionally, swelling may first appear at the toes following pelvic lymph node dissection or radiation therapy. As another example, lymphedema can occur in the arm extending from the armpit as a result of the removal of axillary lymph nodes during breast cancer treatment. In cases where axillary lymph node dissection or radiation therapy is performed, a large number of patients may develop edema, typically starting at the axillary region and extending to the shoulder and inner side of the upper arm. Post-treatment swelling resolves within approximately 1 year in 80 to 90% of patients, indicating it is a temporary swelling associated with cancer treatment. On the other hand, in 10 to 20% of patients, the swelling persists and develops into lymphedema. The swelling gradually worsens, extending to the inner elbow and, in more severe cases, causing hardened swelling that extends to the wrist, the back of the hand, or even to the fingertips. Occasionally, swelling may first appear in the fingers or on the back of the hand following lymph node dissection or radiation therapy performed in the axillary region. The swelling associated with lymphedema gradually worsens over time. The accumulation of lymph fluid leads to an increase in fat deposits and the progression of fibrosis. Consequently, patients may experience pain and discomfort, resulting in the inability to bend their joints. This can lead to difficulties such as being unable to wear shoes or items of clothing, significantly impacting their ability to carry out daily activities. In addition, lymphedema carries the risk of associated complications, with cellulitis being a prominent example. Cellulitis is an acute inflammatory condition observed in regions affected by lymphedema and is thought to affect approximately 30% of lymphedema patients. The onset of cellulitis is marked by sudden redness in the affected area, accompanied by a rapid rise in body temperature to 39 degrees or 40 degrees Celsius within a few hours. This condition can lead to a substantial decline in the patient's quality of life, potentially posing challenges to their ability to engage in social activities. Additionally, the compromised immune function associated with lymphedema significantly increases the risk of cancer. Effective treatment of lymphedema starts with a precise and thorough diagnosis. To make an accurate diagnosis, a differential diagnosis must be conducted while carefully considering factors such as underlying organ disorders, venous abnormalities, lymphatic system dysfunction, aging, obesity, and insufficient physical activity. The standard diagnostic workup includes blood tests, electrocardiography, chest X-rays, chest and abdominal CT scans, and lower limb venous ultrasounds. Following these initial evaluations, more examinations are performed in order to obtain a detailed understanding of the patient's condition, focusing on the assessment of swelling and the evaluation of lymphatic function. Among these examinations, ultrasound imaging, lymphoscintigraphy, and ICG lymphography are particularly important in diagnosis. During an ultrasound examination, the arms or legs affected by swelling are evaluated using ultrasound to assess the condition of the subcutaneous tissue. This procedure allows for the identification of abnormal thickening of the subcutaneous tissue or the presence of fluid accumulation. In cases of swelling, lymphatic fluid accumulates between fat tissues, exhibiting a distinctive cobblestone-like pattern indicative of lymphatic fluid retention. The latest ultrasound technology now allows for the visualization of lymphatic vessels as small as approximately 0.5 millimeters in diameter. The primary diagnostic tool for assessing lymphedema is lymphoscintigraphy, which provides a comprehensive evaluation of the functional status of lymphatic vessels throughout the entire body, serving as an essential component in formulating a treatment plan. During this examination, a radioactive tracer is administered at the base of the toes on both feet for patients with leg swelling, or at the base of the fingers on both hands for those with arm swelling. A specialized device called a scintillation camera is then employed to capture images of the tracer as it is absorbed into the lymphatic vessels, travels to the heart, and eventually accumulates in the bladder as urine. This process enables a detailed visualization of lymphatic flow. In the case of a patient with lymphedema of the left lower limb, as shown on the slide, leakage of the tracer into the adipose tissue has been observed, indicating a disruption in lymphatic flow. ICG lymphography is a new diagnostic method for evaluating lymphatic function. This procedure involves injecting a fluorescent dye known as indocyanine green, ICG, into the tissue near the area being examined, enabling real-time observation of the lymphatic vessels. The affected areas of lymphedema are imaged brightly, offering a visually comprehensible diagnostic approach. While the procedure is effective for observing lymphatic vessels up to a depth of 1 centimeter, it is less suitable for assessing deeper structures. When used with lymphoscintigraphy, ICG lymphography allows for a detailed observation of lymphatic flow. It is also possible to clinically assess the severity of lymphedema. As the condition progresses, the imaging findings exhibit a stepwise transition from linear to splash to stardust to diffuse. This progression serves as a basis for assessing the severity of the condition. Other diagnostic methods include lymphatic vessel MRI, which offers precise insights into lymphatic flow patterns, areas of stagnation, and the specific locations of edema formation. In addition, SPECT-CT allows for detailed differentiation between the superficial and deep lymphatic networks. We use these examinations to perform a thorough differential diagnosis for lymphed. In recent years, the use of high-frequency ultrasound equipment for lymphatic echo examination has emerged as an advanced method to thoroughly assess the condition of lymphatic vessels. By conducting regular lymphatic echo examinations, we are able to detect the early progression of lymphedema. Furthermore, the integration of lymphatic echo examination technology into lymphatic venous anastomosis facilitates the execution of more reliable surgical interventions. Lymphedema treatment is broadly classified into non-surgical and surgical approaches. Non-surgical treatments, including conservative therapies and rehabilitation, are considered the most critical components in lymphedema management. On the other hand, surgical options include reconstructive procedures such as lymphatic venous anastomosis, LVA, and lymphatic vessel transplantation, as well as excisional procedures like fat resection and liposuction. Among these, LVA has garnered attention as a highly effective treatment method. In simple terms, LVA is a surgical procedure where lymphatic vessels with impaired flow, which may be caused by lymph node removal or radiation therapy during cancer treatment, are connected to veins, allowing lymph fluid to return to the heart through the veins. LVA is suitable for all lymphedema patients with a functional lymphatic system and is particularly recommended for those who are experiencing complications caused by cellulitis. Scientific evidence has demonstrated that LVA surgery significantly reduces the risk of cellulitis. While a single surgery may not resolve all issues, between 95 and 100% of patients experience improvement in their symptoms. In our study, we investigated the incidence of cellulitis by comparing a group treated with complex physical therapy alone to a group treated with a combination of complex physical therapy and LVA. The findings revealed that the addition of LVA provided a statistically significant and greater improvement in cellulitis prevention. Several reports have highlighted the effectiveness of LVA. For instance, in a case where LVA was performed on a lymphedema patient experiencing cellulitis over 10 times a year, the frequency of episodes was reduced to approximately 1/8 of the initial frequency. Conveniently located just 2 minutes from Shinjuku Station and directly adjacent to Yoyogi Station in Tokyo, the Mukumi Clinic specializes in lymphedema care, with a particular focus placed on treatment using lymphatic venous anastomosis. Dr. Makoto Mihara, the director and chief surgeon, is a specialist with over 15 years of experience in lymphedema treatment, dedicating his medical career to advancing care for lymphedema. Dr. Mihara has successfully performed approximately 4,000 LVA procedures between April 2006 and June 2023. No major complications have been observed in the past 10 years. The incidence of minor complications, such as lymphatic fluid leakage from the surgical site during the first post-operative week, remains exceedingly low at less than 0.1%. Such cases are effectively managed with standard wound care, including disinfection and dressing changes, and typically resolve naturally within 1 to 2 weeks. Dr. Mihara has extensive experience presenting research papers and providing surgical guidance overseas. At his clinic in Japan, he actively accepts international patients. Renowned for his expertise in lymphedema treatment, Dr. Mihara has earned the trust of patients and physicians alike, both in Japan and overseas. We hope this video has provided you with helpful information about lymphedema, as well as its diagnostic methods and treatments. Enjoy a healthy life until you're 100 years old. This is lymphedema expert Dr. Mihara's commitment to his patients. If you are struggling with lymphedema, we encourage you to refer to the information presented in this video. If you are considering treatment to manage lymphedema and maintain a long and healthy life, please do not hesitate to consult the Mukumi Clinic.